So why do we treat fibromyalgia like onions in our practice? I'll tell you about that here in a second. So my name is Dr. Aaron Andrews. I'm a chiropractic neurologist at PC Medical Centers in Cape Girardeau, Missouri. We are the only integrated medical clinic in probably a 150-mile radius, and I'm going to talk about why that's special also in a little bit. So back to fibromyalgia. We're going to have a kind of an emotional talk about that because it's an emotional subject for a lot of people. Fibromyalgia is probably one of the most misdiagnosed, mismanaged, mistreated condition that there is out there. It's an uphill battle for a lot of patients, emotionally and physically. They have a lot of symptoms. They're very tired. It's a debilitating condition, and it's an emotional condition because a lot of them have been run through what I call the medical loop of crazy, which means they've been to a doctor which does an exam and diagnoses them with something else. Then they have an x-ray and it's normal, or lab work and it's normal, or it goes to another doctor and his exam is normal. And so it just takes a long time to figure out. Most fibromyalgia patients have been to eight doctors, and have waited 5 or 6 years for a proper diagnosis of their condition. So that's why it's called the loop of crazy, all right? And that's why it is often mismanaged. There's a lot of bad information out there and a lot of bad treatments. And I don't know, if you Google it, there's so much about fibromyalgia, but again, there's so little about fibromyalgia because we don't know the cause. There's some theories out there. One theory says that it's amplified pain signals. Their nerves are kind of going haywire. They feel pain a lot easier than some people. There's some studies that show that fibromyalgia patients have decreased serotonin. It's an important neurotransmitter in your brain for pain and mood and sleep. There's trigger points. There's a whole lot of different pieces of puzzle and a whole lot of different causes, but no one can really nail down one of them. So diagnosis, you are not crazy. It is not in your head. Fibromyalgia is a specific condition. It has a diagnosis. I have a diagnosis code for it. There is specific diagnostic criteria for me and our clinic to figure out that you do have it. So it is an issue. Don't let people tell you that it's a wastebasket, problem. We don't know what's wrong with you. You've got fibromyalgia. Don't let people tell you that. It is an issue, and it is something that we greatly help in our office. Studies show 5 to 10% of the population can have this. It is more common in females and can hit at really any age. So back to the onion. Why do we treat fibromyalgia patients like onions? Well, first of all, we look at the different layers, okay? We look at the different layers to diagnose you. Soft tissue, bone, muscle, diet, inflammation. There's a lot of different things we look at. We kind of peel these layers back, and sleep and work and posture and exercise. There's a lot of different things that we do. But also, since I talked about it earlier in the video, we're the only integrated medical clinic in a 150-mile radius in between Nashville, Memphis, St. Louis. So what that means is we're the only clinic that has medical care, chiropractic care, rehab, nutrition, everything under one roof. So all of our doctors, we have a multidisciplinary approach. We work together to treat our patients effectively to improve their function, decrease their pain without steroids, without medicine, without surgery. And so that's, again, the different layers in our office, the different layers of the onion that we use to treat our patients, like trigger point injections, chiropractic care, rehab, exercise, nutrition, vitamins, sleep, oxygen therapy. There's a whole lot of things that we do that we have in our toolbox that most clinics do not have to treat a lot of conditions, especially fibromyalgia. So if you have fibromyalgia, or you know somebody that has it, or question that they may have it, you can send them in here, tag them with this video, show them this video, tag them in the comments. Everyone can come in for a free consultation to find out why our office is different, how we can help you, and how we can peel these layers back and get you better. So thanks for watching the video. Please share it. Please comment, like our page. Go and check out all of our other content. We're really putting out some great content for you guys. I really appreciate you watching this video. Thank you very much.